My name's Tom Blount. I'm one of the pediatric cardiologists here at Children's Nebraska. There's really nothing from a cardiology standpoint that we can't handle and haven't seen. A lot of our congenital patients are with us from birth into their 20s, and so we get to know those families really, really well. And our subspecialty care is really excellent. We've got pediatric heart failure and transplant, electrophysiology, interventional cath, surgical intervention, and high-risk infant care. Kids that I follow from birth up through their teenage years who were born with congenital heart disease, such as holes in the heart, septal defects, valve problems. And once patients make it through their adolescent period and are surviving and thriving into young adulthood, we transition to our adult congenital heart disease providers who follow them for the remainder of their lives. I get a lot of referrals for new heart murmurs that need further investigation. Anytime that a provider listens to a heart murmur and suspects that it's potentially something more malignant, the murmur is loud, if the murmur is in a location you're not used to hearing it, if the murmur is in diastole, or you have a patient with chest pain with activity, any family history of first-degree relatives, parents, siblings or offspring with congenital heart disease, or a history of arrhythmia or sudden cardiac death or aborted sudden cardiac death, that certainly is a reason to get it investigated by us. In terms of patients with syncope, we have developed over the last several years a pathway that we would like for our referring providers to use. Really, anytime a provider has any concerns, I want them to feel comfortable sending a patient to me and our team so that we can take the appropriate steps to get that investigated. Any testing that needs to be done, a lot of that testing can be organized and arranged on the same day of the clinic visit. For example, electrocardiograms, echocardiograms. Oftentimes we'll bring patients back for a cardiac CT or an MRI. We can also do exercise stress testing on site. I'm extremely proud of our outreach efforts, which have been going on for decades. Nebraska is a unique situation in that there's a lot of geography that funnels to us at Children's Nebraska, including really all of the state of Nebraska, a lot of western Iowa, all the way up as far north as Rapid City, South Dakota. We have taken cardiology to the communities of Nebraska and our neighboring states. And I know that that makes a huge difference for patients and families. At our outreach locations, our families can expect to receive excellent care on par with what they would receive here at Children's Nebraska. Collaboration and communication with our referring providers is of paramount importance. At the end of every clinic visit, we're going to send you a copy of our clinic notes to work together and figure out how to provide the best care for our patients.